All right, so I'm going to jump into some DiSC stuff. I love talking about DiSC. Debbie's going to help me out and how it just relates to. We're going to transition from not team to more patient direction, right? So I think DiSC plays a huge role in how you operate with your team. We've talked about that. So interaction, how people interact, how they feel appreciated, all that kind of stuff. So uh, let me just share my screen. All right, there's us. All right. So I was following on my other computer, Paul. I've got to get caught up here. All right. So you guys can look at page 38, 39, 40. Okay. We're gonna take take us through everything. For me, I actually like this. This is a great page as well that I'll share with you guys for DiSC. And I think the biggest thing that I find with my teams is that they don't they get DiSC, they understand it, like they know their own. It's kind of like appreciation languages. You know your own, but do you know other people's, right? So are you able to not only identify your your patient's DiSC, right? Not, are then you able to adapt? So the three levels of application: know yourself, be able to identify others, and then adapt to that style. That's what I want to do. Be able to get to there. All right, and I'll go back and forth here a little bit, but I love this screen because it really breaks down how to identify. So if you haven't taken the DiSC profile, I can email you a free example, just an abbreviated version of it. But everybody should have that. The booklet is great. I think the booklet's $24 on a site we order online. You can get that. But knowing your DiSC there's all sorts of personality profiles out there. The Enneagram's out there now. DiSC is so nice because it's so easy to understand. There's just 4 styles. And what I want to focus on with you is, and Debbie and I will really get into this, is how are you sharing the information for case acceptance with your patients? Okay. So when I sit down with a patient, I'm trying to figure out, are they an external processor? Are they extroverted in nature? Do they tell? Okay. Are they tellers? Or are they on the quiet side, more asking, introverted? Okay. Trying to shrink this down enough where everybody can see everything. Okay. So tellers or askers, introverts, extroverts, those are typically the first questions I ask. Are they this or that? And it's pretty obvious if they're an extrovert. But I think a lot of patients who are fearful, they could be an extrovert outside the office, but inside the office, they become an introvert if they're fearful. So you're just being conscious of that. So when your admin team gives you an idea of what their personality style might be, it might just like give you an idea. Don't look at that as hard and fast. Okay. And there's no wrong personality style. We're just trying to identify what they are. Once I get to first question, extrovert, introvert, let's say they're extroverted, then I ask my second question. Are they people or are they task? Okay. So are they people or are they task? The people should stand out. They're maybe leaning in more. They're more like laid back with their mouth open over here. Okay, ready to go. They like to see the pictures on the screen, right? They might want more brochures. They just want you to get the job done. I'm here for an hour. What do you mean an hour? I just wanted my teeth cleaned. Hey, can you get the stain removed? The stain right here is really bothering me. I notice it, right? I just want to make sure my teeth feel good. I want to have no surprises. And they got to function well. I just want to make sure they're functioning and long lasting. I want to keep my teeth. So you start to hear things from people about this. Now, I think our approach has to change. So in adaptation, a lot of times when Paul and I do these courses, we just focus on what's your DiSC and how to identify. What I want us to make sure we get today is how to make sure you change your approach to each style. So I'm an I personality style with a D backup. My I is dominant. So you got to ask yourself, what is the hardest style for me to adapt to? It's the diagonal, right? It's this diagonal shift from I to C. That's the furthest gap. And the more extreme I am, right? I'm further and further out here, more extreme I, okay? The harder it is for me to reach here. If I'm a mild I and a mild D, I'm easier to adapt, right? It's easier for me to flow within these styles. Okay. So I want you to first understand, someone like a Jim Carrey, who's an extreme I off the chart, is going to have a real hard time adapting to other styles. People will think something's wrong with him if all of a sudden he starts coming at you like he's an S or a C. Okay. Same thing for an S. If you're an S personality style, it's really extreme. You're really comfort in your own way, your own skin, right? Your own way you do things. It's going to be harder for you to adapt to maybe a D. Okay. So when you do this, you got to have a few tricks to the trade, how they like to be treated. What do we like to say to them so that we can, connect appropriately. So on page, let's see, on the next page, I'll go down a page here. Page 41, right? How to communicate effectively with them. This is as simple as, we can make it for you. Don't make it super complicated. The biggest challenge I see in hygiene, twofold. One is case acceptance for the doctor. And two is I've got a long-standing hygiene patient who is now a prophy patient turning into a perio patient. How do I communicate with them? I'm so used to talking to them about their trips to Disney and their whatever it might be, right? I think the transition in this can be understood in DiSC. So Paula, we'll say, or Debbie, I can talk with Debbie about this. We'll say, put your D hat on when you go in there. You should be able to give the doctor a heads up on what their personality style is. It should be a part of your checklist that you have that you're running through. Obviously review medical history, COVID's added all kinds of things to, preclinical rinse, all of these things. But in that checklist should be, do I know their DiSC already? In your Dentrix family file, patient notes is where you document what their DiSC is. I think everybody's using Dentrix on this group. So in EagleSoft, it's patient memo, right? It's in there. So know where you put that. So if you don't have that identified, identify it once so that you don't have to keep identifying. You just focus on adaptation. All right. So Debbie, when you've got a D patient in the chair, it's a long-standing patient, it's a D patient. What's been your history of approach that you use them that you think works well with them to win them over to your side? They're listening to you better. They feel like you guys are connected.
I tend to be pretty, actually, when it says direct and blunt, I tend to do that.
Yeah, that's you. What is your DiSC?
I'm an SC.
Okay.
So it's hard. Ds can be intimidating.
Yeah.
To an S. So I find that I have to say, so Eric, we did your periodontal evaluation today, and as you could hear from the numbers, it sounds like things are changing. How did that sound to you?
Yeah, no, I noticed there was something about the numbers calling out that I hadn't heard before. Right?
Yeah, and it's different than it was last time. It's time that we address this infection.
Yeah.
How do you feel about that?
Yeah.
You might not say feel to a D, but.
Yeah, that makes sense. Might be more makes sense, but I do like feel. Yeah. How do you feel about taking care of this? So remember, this is what I want everybody to remember. What's the number one thing the D wants? That's to be in control. That's why they call up and say, I just want a cleaning, right? I thought I was getting my teeth cleaned today. They want to be in control. Their fear is to be manipulated. And so the bait and switch is what you want to avoid here. So if they can learn in the process, whether it's the perio evaluation, the overhear psychology, asking them direct questions, right? To at the end saying, all right, so you got a decision to make here, Mr. D. You got a decision to make. Do you want to start a process of saving your teeth, or do you want to risk and moving down the path of letting this gum disease continue to fester and become a bigger problem where you lose your teeth? And I'm giving them a choice. Now they're in control of that conversation. Oh, I want to save my teeth. Okay, let's talk about how you can do that. So what I'm hearing you say is you want to save your teeth. Here's how you could do that. Okay, you're testing the buy-in in that process as well. Now with the I personality, the number one thing they want is recognition. Their fear is to be ignored. So Debbie, when you have an I patient in, and let's use the same analogy, they're a prophy patient all along, long-standing patient. Now they're moving into gum disease. Do you change from D to I how you talk about it?
Oh, sure.
Yeah.
I talk like an I. Make it fun, make it all about them. You know, geez, have you noticed your breath has been bad lately? Or have you noticed that you haven't had the attention from your boyfriend that you maybe have been getting before? It depends on the person.
Yeah. Show them the loss of recognition, right? The consequence of the condition they're existing in, gum disease. Show them the consequence of that. So that's what Debbie's talking about, the attention. Have you noticed this, right? And so when you're working with an eye patient and they have gum disease now, you say, I know that your teeth are really important to you, and having just a bright smile is essential. How do you feel about either having bad breath or even moving into gum disease where there's black spaces and your teeth look longer? How do you feel about that? Now you can start using the feel side on the right side of the grid here, right? Feel. And they're going to start reflecting that on how they judge themselves through appearance, or how people will see them in that, or how it relates to their profession. Then you grab a hold of that. Remember, people buy for their reasons, not your reasons. So you have to make sure you have a connection there. Make sense? All right, good. So let's look at the S. The number one thing, this is the easy group for me, because the number one thing they want is harmony, and their biggest fear is conflict. And when there's gum disease that continues on its own, that's going to lead to conflict, right? So Debbie, you being an S, how do you take that prophy patient to, say, a perio patient when they're an S? Do you change something?
Yeah, I explained more. Eric, what we found today, as you could hear, was evidence of the numbers changing. How do you feel about that? I'm concerned that I'm seeing some things that aren't as healthy as they were before.
Yeah. Yeah, there's a difference.
Is that a concern for you?
Yeah,
there
I'm
is a
concerned
difference.
About it. Yeah.
If you go ahead.
No, go ahead, Debbie.
If you knew that there were a way that we could treat this infection and take away this disease that you have, would it make sense to you to come up with a plan to do that?
Yeah, perfect. And what I was going to say is, if you notice, Debbie's tone of voice has been a huge change from D to I, right? Have more fun with the I, to S. It's slower, it's calmer, it's painting a picture. So even your Harige has to adapt with this. And you probably do that naturally when you pick up on the patient, you're connecting with them, you're able to adapt to their style. And so the S, knowing that there's this underlying, it's almost a fear of conflict, that they want harmony. So I would present that to them. I'd say, and you could use belief windows, word pictures, and all these things. We'll come back around to those. But, you could simply say to the patient, it makes sense that you want to keep things healthy. It makes sense that you want to keep your teeth for the rest of your life. I understand that. How does it feel to you to hear me say it? There's something now challenging that. There's something now that's going to stand in the way of you saving your teeth. How do you feel about that? And all of a sudden you just say, you told me you wanted this. Here's something that's a barrier of you getting that. How do you feel about it? And all of a sudden it starts to draw out what what you need to hear them say. Then you could say, okay, why don't we talk about a plan and how we can stop it? All right. And then the C is my challenge. The C is my challenge. So Debbie, I'd love to hear what you say. The C, they want accuracy. They don't want to be criticized for making the wrong decision. They're going to overthink things. They're going to analyze. They're going to want to know the details. So Debbie, when you're talking with the C, what do you do differently? Is there any tricks of the trade that you use with a C personality type?
Eric, as you could hear from the numbers, today you had 25 sites of bleeding.
Wow.
And
There you go.
if you remember correctly, last time when we did this, you had 2.
Oh, wow.
So there's been a huge change.
Yeah.
And on you remember what the pockets were when we took the measurements, the space between the gum and the tooth that we talked about last time. Yours is getting deeper. last time we measured areas, you had 25 sites that measured over 6. Today, or I'm losing my train of thought here. Last time you had no sites that measured over 6 millimeters. Today we found 10 sites that measured over 6 millimeters.
Gotcha.
So statistically,
wow.
You're headed in the wrong direction with your gums.
How accurate would you say those measurements are?
Those measurements today.
How accurate. There you go.
Yeah.
I
How
find
precise,
them to be a
yeah.
pretty accurate measurement of how unhealthy your mouth is today.
Yeah. Perfect. So the C patient, they want to make the right decision. A lot of times they'll know the answers, and that's typically a new patient coming in will challenge you with questions that are C patient they know the answers to. But an existing patient that we want to transition from prophy to perio, because we know this has been going on, it's building up. You want to be able to give them the data. You want to be able to share those details. And that's exactly what Debbie's doing. And if it's personal data, even better, then you connect it to some national data. Uh-oh, Paula's getting her eye hat on.
Oh, it's the eye. You get it. How
So-
did you know?
Where's your C hat, Paula? Do you have your C hat?
Yeah, I got them all.
Yeah, let's see your C hat. Let's talk C. So with a C, like put your C hat on. She's a detective, right? She's looking for the details, looking at the details. What you have to help a C with is make the decision. A lot of times we have a tendency to give the data with the C, but then we don't get to a place where we test the buy-in so that they know how to make the next step, how to take it to the next level, because they'll get stuck in this analysis where they just overthink. My son is getting married this summer, and my wife, every night we lay in bed, she's looking for her dress for the wedding every night. And every night she'll show me a dress. She'll go, "Do you like this one?" And I'll say, "Yeah, I love that one. That would look great." And then sometimes I'll say, "No, I don't like that one." But I mean, she's probably showed me at least 20 dresses that we both like, but she has not pulled the trigger yet. So I didn't know this. She was waiting to figure out what my son's colors were going to be to wear so that she could kind of coordinate with that the right way. I had no idea. There's more details. I would have bought in like 5 outfits by now if I had looked at everything. So I would just pull the trigger, figure it out later. But the C is going to wait to make the best possible decision. So you might need to plant the perio seed with the C patient and talk about things that they can do at home versus, and then when they come back, say, all right, let's come to an agreement that if I reevaluate the health of your gums at the next visit, if it's not significantly better, we'll talk about how to do something at that point. If they're not ready to move forward today, right? And you can do that with any personality type, but especially be prepared for the C. Now, let's talk about just belief windows or word pictures to help each of these patients, right? So, with the S, I love to use high blood pressure for perio. Perfect analogy for the S, right? Do you know anyone who has high blood pressure? All right, there's our S hat, right? Paul's got her S hat on, yeah. Precious, the S. So the S personality type, gum disease, periodontal disease is the high blood pressure, okay, of the mouth. Now, what happens to a patient who has high blood pressure? If they don't do anything about it, what does it turn into? And they'll say, oh, stroke or heart attack. Yeah, okay, so in our case, that's tooth loss. How would you feel if you right? How would you feel if you let the gum disease turn into the heart attack, which would be tooth loss? Are you okay with that? Do you want to stop that? They're going to then talk about stopping it. Now with the I look again, I asked them, I say, this isn't really, it's a word picture, but it's about dentistry. She's back to her eye hat. So I say, I even start out with that saying, have you heard that saying, long in the tooth? That's an old saying. Not many people have heard of that. That means they're experienced. They've been around the block a few times, right? But long in the tooth, if you think about it, that actually happens. Have you ever seen anyone who's long in the tooth? You see the really long teeth, black spaces, the gums have receded. They'll know someone who's had that. And I'll ask them, how do you think about that look? What do you think's going on there? They're one step away from losing their teeth. Did you know that could have been preventable? Okay, you're at the earliest stages of that. So that's the example you can use for the I. Debbie, do you have any I or S word pictures you use?
I tend to use the splinter a lot.
Okay.
Under the gum.
That
so
could be a
it's
D
the
example.
visual.
Yeah, share that one for the D example. That's a good one.
Gum disease starts with what's like a splinter that builds up under your gums, and as like a splinter would in your finger.
Mm-hmm.
Do you know how a splinter causes your finger to swell up, and if you don't remove it, it could get infected?
Oh, wow. Yeah,
So-
I know what you're talking about.
What we're seeing under your gums today is a buildup of stuff that's just like a splinter. If we don't remove it, then your gums could continue to get more infected. And we need to remove it to allow your body to heal.
I gotcha. Okay. All right, good. So she's showing a visual with consequences. That's good. And the C again, it's a tougher sell. It's on sharing the data. I think I would show them a intraoral picture of the perio ruler with a healthy depth. And then I would show them a picture of, in their mouth, an unhealthy area with bleeding coming out in the depth of that pocket. And I would just show them the comparison and say that your body is heading towards this. This is a great person for your picture library to show the long in the tooth. I think the eye even would work with that. Any of these patients probably, but the C will want to see the data. Here's what happens. You could even say, Paula, see Paula, right? Paula, the detective Paula, right? The 80% of the population has some form of gum disease, right? And half of those people have it in in such a severe case, they're at risk for losing their teeth.
Wow. That sounds, do you have a link to that?
Yeah. We'll get you some data. We'll get you some more data. Yeah. And so you're starting to you're moving out of that healthy 20% range and you're moving into that negative range. Do you want to do something about that?
Yeah, absolutely. I do not want, my self-esteem is based on performance, and I really want to go that direction with my graph.
That is funny. All right. Excellent. Thank you, Paula, the C detective. So when you're looking at this grid, right, this handout is a one-page handout. You should have this taped to the back of a cupboard in your room if you can't memorize it, and know where they are. Know what they want to have, right? Make them feel at home. Spend time building rapport. Use statements like patients in the past who've had your exact problems. Law of the herd. They want to fit in and be connected to everyone, okay? Give them personal help. Directive questions. Would you like to get this taken care of before it becomes a bigger problem? Okay, direct them into the solution. So use this as a cheat sheet to help you, okay? Does that make sense?
That's really good.
All right.
So one of the things that helps me with this, Eric, is understanding, now my hair's a mess, but is understanding the fears of each personality profile.
Yeah.
So the D's biggest fear is lack of control.
Yeah.
And
Loss of control.
The I's biggest fear is being ignored. That's why they wear bright colors and they're loud and
Drive the convertible.
They want to be seen. Yeah. And the S's biggest fear is change and conflict. And the C's biggest fear is making a mistake.
Yeah, and being
That's
criticized
why-
for making the wrong decision. Yeah.
Yes. That's why it takes them so long to make a decision. It's because of that. So how would it be if we actually had a live role play with two of our, I guess.
All of a sudden, everybody loses their connection.
All of a sudden, everybody turns off their camera.
Oh, I'm not here anymore. You can't see me. Yeah. Can't call on me.
So, Dr. Allgood, would you be up for practicing? You're on mute. By the way.
You're muted, Dr. Allgood. You got to unmute.
I have to unmute.
I muted everybody during
Am
the
I
break.
unmute now?
There you go.
Yeah.
Yeah.
Okay. No, I don't want to do it.
You're not a willing wit, are you? Oh, yes, you are a willing wit, whatever it takes.
I don't know what I am.
Well,
Yeah, I'll do whatever you
What
want.
what if you're the doctor? Would that be good for you to be a doctor?
I'm retired.
Try
I'll
that.
try.
Try it. Yeah.
How
That's
about if
not what
you're
it
a
was.
how about if you're an S doctor and you have a D patient? So who would like to be D, a D patient? who's good at playing the D? Kayla, do you have some D? No?
Lauren's the D.
All
Yeah.
right, here we go. All right, so Dr. Allgood is going to present perio to this, without using that word, perio, to a D patient. And Lauren is a project manager for an apartment complex. Let's say she's a project manager. And her dominant buying motive, her number one goal is she can't afford in her busy schedule to have any emergencies or interruptions in her time. So how are you going to present gum disease to Lauren, the D? So Lauren, are you unmuted?
Yes, I'm ready.
Okay,
Now,
Dr. Allgood.
Do you want me to adapt to that, or do you want me to just go ahead and play the S?
Yeah, you gotta adapt. You gotta become a D.
Oh, that's easy.
Well, for some S's, that is not easy at all. All right, so roll with it, Dr. Allgood. Just kind of play around with it.
Well, I know you saw we found these issues with your gums and all. How do you feel about that?
I had issues with my gums. I didn't know that.
You didn't know that, did you?
No.
Well, didn't we show you the pictures on the screen of that bleeding and all that crap under your gum?
No, I didn't see those.
You did.
I was on my phone. Lauren, you're like, I was on my phone answering
Yeah,
text
it's on my
messages.
phone. I don't know. Yeah.
Okay, well.
Also, how much longer is this going to take?
All right, you got somewhere you got to be?
Yes,
Okay. What time do you need to get out of here?
like 5 minutes ago.
5 minutes ago. Well, do you care about the way your mouth is?
I do care.
Okay. Can you give me another 5 minutes?
Sure. Clock
Okay.
starts now.
Okay. You start, and so you didn't see those pictures. Let me show them to you again. Would that be okay?
Yes,
All right. You see that blood and pus coming out of there now?
I do.
What do you think about that?
It doesn't look good. What can I do to fix it?
Okay. Might fix it. If you don't have it taken care of, you think it'll mess up your job sometimes?
I don't know. You schedule me tomorrow to get it fixed?
Tomorrow.
That's good. Let's stop there. That was perfect.
Good job. Good job. Yeah. 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 Then we shoot ourselves in the foot and say, yeah, we had a cancellation tomorrow. We can put you in there. Yeah.
Dr. Allgood, you adapted very well because he's not normally, I mean, you have D, but you don't really promote D. You're the Southern gentleman, right?
Yeah, well, you know what? I'm retired now, Paul. I can act any damn way I want.
There you go. Yes, you can. Yes, you can. All right, so let's do the I and the C. So who wants to be the eye hygienist? Katie, are you an I? You're not? You're not an I?
I think Katie's are you an S, Katie, or a C? S. Yeah, S. Yeah.
Okay. So who else on your team is I? Katie Lynn, are you I? All right, Katie Lynn's got some I. Okay. Then we need a C. Who's got C personality? What's that? All right. Okay. So is that
the forced raised hand?
I gotcha. Is that I can't tell exactly who that is. Is that Kayla?
Yes.
Okay. All right. Okay. So Katie Lynn, now you're the I, Kayla's the C. So Kayla works in IT. She's a computer tech person. Okay. And let's talk to her about gum disease. She's got gum disease. And Katie Lynn, you're the I, and Kayla's number one goal is to what can we say? To keep all of her teeth. She doesn't want to lose any teeth. Okay.
Grandma
Yeah.
lost her teeth. She doesn't want to lose her teeth like grandma.
And so how are you going to present gum disease to Kayla? Okay. All right. Go for it, Katie Lynn.
This is actually going to be really hard. I'm not a hygienist, so I don't know how that would Huh. Okay. Well, this will be fun. I can
Do-
practice. I'm
here,
very
do-
sorry if I'm talking too much. So
Yeah, do this from the perspective of yourself if you want, as a hygiene coordinator, taking that data back out, a case presentation, or you can take it from the standpoint of a hygienist and just pretend. That's up to you.
okay. So Kayla, you work in IT?
I do.
Okay, so hey, have a lot of cameras that can show like gum disease and issues that are going on, intraoral cameras, pictures.
Can they show what's going on with my teeth and my gums?
Yeah, the technology is great, and they're very clear pictures. It can show in-depth situations that are going on with your teeth and your gum. And I've already forgotten because I'm talking too much. I've already forgotten what I'm supposed to present. Oh my gosh, I'm so sorry.
Just gum disease. Just gum disease. Yeah.
And how that relates to her number one goal of not losing any teeth.
I don't know if I'm going to be good at this. This is
That's okay.
terrible. I'm so embarrassed.
You're doing great, and this is why we have each other. We're going to help each other because this is what we do in team meetings, right, Debbie? I mean, you sit around and do this, and you help each other. All right, how would you go about it? Somebody pitch in. Debbie, give her some thoughts. What could she say?
You could, let's see, Kayla's the
Patient.
C,
Yep. C patient. Yep.
and she's the C. You already know, Kayla, you told me that you didn't want to lose your teeth like your grandmother did. Is that right?
Perfect.
That's right.
Right. Did you know that gum disease was one of the number 1 and 2 reasons that people lose their teeth today? Decay being number 1, having a gum infection, you could lose teeth.
I didn't know that.
Did
I
you
didn't
know
know
that?
until today.
Would it make sense for you to treat the infection that you have, knowing that you could lose a tooth if we didn't, or lose more teeth?
How would we
So
do
that
that?
you would,
It's okay.
how
You
would
can
we,
skip that part.
what,
How would we do that?
I'm the C that wants to know how we would do it.
This is good. This is good. How will we do that? That's what C would definitely ask that.
Yeah.
Kayla, we're going to use specialized tools and instruments, and we're going to do lots of very technical treatment or technical work to get below the gum line. We want to get rid of all that bacteria and all those things that are causing the gum disease that you have, so that we can save your tooth so you won't lose it. Is that making sense?
It does. When can we do it?
When would you like to do it?
As soon as possible.
If we could get you in the schedule tomorrow, would that work for you?
Yes. Could you also print me all of this information out so I can look over it when I get home tonight?
I can
wanna
give you
study.
all the detail you need. Would you need any brochures or websites or?
Sure. I would love them all.
All right, give him a hand. So we've got some emoticons at the bottom where you can clap. You see where mine is? Good job. That was awesome, guys. Very good. Now, notice something. I don't know how to take them off. I guess they go off.
They'll just go away. Yeah.
Notice something about this. Did Debbie go into a lecture on perio? Did you notice that? That's the fastest way to lose somebody's attention. You know, you only have 7 seconds. And she didn't go into a lecture on perio. She asked questions, and she went straight to what we know about Kayla being a C, what her job is, technical, IT, she loved computer stuff, technology, and she also went straight to her dominant buying motive of not wanting to lose any teeth. And how easy was that? I mean, Debbie makes it look easy, but it's not super easy, is it? If you're not in the habit of it. So Katie Lynn, thank you for being willing. But what did you get from that? I know you're on mute.
What did I get from that?
Yeah, what did you get from it?
I don't know. I think I might actually be a really high I, because I had a really hard time switching to the C. Like, that seems so unnatural for me.
Yeah.
And that's just something that I obviously need to work on. And I really liked how Debbie just switch. I mean, it was immediate. She was able to address to C in the C language. So that was great.
That
It
was,
just takes practice.
Mm-hmm.
and the only way we're gonna learn it, I mean, because this is, there's 3 phases in the learning. There's listening, and then there's doing it, and then there's mastering it. And in the doing it process, it feels a little awkward. And Debbie's a master, so it just comes natural to her. But right now, when we're in the doing process, it feels a little bit uncomfortable. It's kind of like the crossing the arms thing we talked about, you know. Now you're asking me to cross my arms the opposite way, and that feels really weird. So that's exactly where we are. But yeah,
There's 4
ahead.
steps, Paula, right? Unconsciously incompetent, right? Unconsciously incompetent. I have no idea. I don't know what I don't know, right? Then there's consciously incompetent. Oh, I just realized I don't know how to do something. Okay. Then you start, that's where Paula's talking about, you start working on it, right? And then you get into you're consciously competent, where you're just focusing, like you have to work on it. You have to really think about it and really turn that on. I might forget to do it sometimes and come back. And then there's just the unconsciously competent. It just flows. And that's the level that Paul is talking about, where you just get to a place where it's just a part of you. And so like if I were working with that C patient on the details, but I'm in a hurry because I'm a hygienist, right? And I got to convert them, win them over. I need to know a few things beforehand. And I'm really talking about a summation, right? Like Dr. Algo was saying, the pictures we looked at before and all that kind of stuff. This is the summation of all of that. And how I break down that summation is going to be different between D, I, S, or C. D, it's going to be bing, bang, boom, direct, bottom line, how they're going to benefit from it, keep them, maintain control, either or questions. Know that quickly. I, it's going to be fun. It's going to be talking about recovering from something that could become a bigger challenge. S, it's going to be softer. It's going to be more like, how do you maintain things, harmoniously lead them with questions? Wouldn't it make sense to do this? How do you feel about getting this taken care of? And then the C is going to be really a hard one for me. Again, like you, Caitlin, it's like, okay, I got to slow down. I got to remember to use specific words, exact, accurate, detailed, procedures. We've done this thousands of times. The research has shown, and then try to get them to a place to make that decision. So if you can remember that all those styles and be ready to adapt, it's just going to help you. It's a little advantage for you to give you that next level. Now, being a hygiene coordinator, right? Being someone who's going to be in charge of all this, you might have to pick up the phone and call a patient, right? And be able to get into this again with them. So you might look at the notes, that reason for return that we'll talk about, and say, you know, I know that Vicki talked with you at your last hygiene visit, and I know that she's really concerned. I can see in her detailed notes here, C patient, right? In her detailed notes here that she documented that she's concerned about 14 areas of bleeding in your mouth. Now with a D, you might just get on the phone and say, yeah, hi, Donald. Vicki asked me to give you a call. She's concerned because last time you're in, she has here noted in her charts, she's concerned about the bleeding in your gums and how it's going to affect you being able to keep your teeth. I'm assuming that's a concern for you, right? Yep. Okay. Would it make sense for us to get you scheduled back with her again then? Yep. It's more direct, being boom, boom, boom.
Yeah,
just
make
flow,
it
flow,
quick.
flow.
Make
Yeah.
it quick. They don't want the long explanation, all that. You just got to know. I got to know when to hold them, when to fold them, right?
Yes.
So it takes
It's also-
practice. Yeah, go Debbie.
I was just going to say, having been there on your side too, it takes a lot of practice. And in a situation like this, for me, even it's harder when you get back to your practice and your
Yeah,
environment that you're used to talking in. It will come differently to you.
yeah,
It'll be easier.
for sure.
So let's summarize here. Do you know yourself, right? Do you know your own personal DiSC? Okay. If you don't know that, get with us. We'll help you. Number 2, do you know how to identify others using that 4-square grid? Okay. You got to be an expert at just either or, top or bottom, left or right, extrovert, introvert, people or task. That's going to allow you to get it down to the nitty gritty. Okay. Then are you labeling them in family file patient notes so that I don't have to keep doing that? Once I do that, it's done. And then lastly, are you using a language? You know, Debbie's the hygienist. So I say, Debbie, when you go in there, or I preheat her, say, hey, you got an S patient in there. Put your S hat on like Paula does, right? Put your I hat on when you go in there. So now level 3 is adaptation. A lot of times we're so busy and we're just moving and just going through the daily operations, we forget to adapt. We know that our DiSC, we know their DiSC, but we don't apply the action. So I really want you to think about how you, as a hygienist or hygiene coordinator or doctor, right, team member, how are you helping your team adapt? Are you preheating your next team member in line to know their DiSC when they go in? When they're done presenting and you were listening, can you give them some feedback, some coaching tips on how they could be more like a C? And I would want that if I were that team member. I'd want to get better and better at this. One big asterisk here, Paula, is people come to you because they like your personality. We're not asking you to change your personality, especially for the whole hour. What we're asking you to do is when it's time to deliver the message, that you do it in the right format for that person's ears. What station are they tuned into? And you need to tune your mouth, the delivery message, into that same station.
Speak their language. It's kind of like you said with love languages. You got to speak their language. Because they may not get it from you. They might just go like, what? What are you talking about? If you're the C and you go into this long explanation and the I and the D are like, shut up already,
Yeah. Yeah. You'll lose them quickly if you overdo it. Yeah. And that goes back to the perio soapbox conversation that Paula I identified that Debbie did not do in the conversation.
Yeah.
She didn't go into a long periodontal disease is, and then she just said it's one or two reasons how people lose their teeth. Even for the C, she went in just enough detail. With the D, you don't need to go into all that. Keep it simple.
Yeah, I know we're going to talk about this again when we get to dominant buying motive and things like that, but I think it's worth repeating again when we get there, is that most clinical team members believe that one of our main purposes is educating the patient. And I think that is a very strong purpose, is to educate the patient. But you know what? It has to be related to something the patient is interested in. In other words, you could educate me all day long about bulldozers, but I don't really care about bulldozers. So it's going to go in one ear and out the other. Have you ever felt like you were educating a patient and they weren't listening? Yeah. Why is that? Because you're not talking about something they're interested in. So we've got to find out what they're interested in. What did we do with Kayla as an IT person? What is she interested in? She's interested in keeping her teeth, not having a denture like your grandmother. So that's how we're going to open the window to be able to educate her. True?
And you say window, like belief window plays a role here. So if she's into IT, I'm going to talk about computers crashing.
Yep.
Right? That's just a normal. Now, if she's a homemaker, I'm going to talk about how the house has to operate and function and how she manages that. Okay. If a lawyer, right, or an attorney, talking about by the letter of the law, you can't break the law, just like you can't beat gum disease on your own. Teachers. You know what
I like to say to a CPA? Hey, dude, it's April 15th in your mouth.
And you haven't filed your taxes yet?
You've missed the deadline. You're in trouble now. Okay.
And that's especially an important conversation that you and your team can talk about at morning huddle. If you've got a longstanding patient coming in, and I know at Dr. Pierre's office, you have the pink sheet, the front and the back, where you're documenting their hobbies and things like that. It's super important for you to know what this person does, their hobbies, so you can connect with them. And you might need to practice that with a team member. Say, well, what would I say to a teacher? I know that she's a teacher. What would I say to her? She's a C personality type. How can I relate this to her? What's going on?
You just failed your perio exam.
Yeah, failed the test. You got 28 students in your class and 14 of them are misbehaving really badly. They're not turning in their assignments. They're overdue. They're failing, right? Yeah.
That's good.
You just have to have fun with your team members to get to that place. But DiSC, case presentation, belief windows, understanding your patient, it's going to be a super important part of your case acceptance that we're going to get into as the next 2 days unfold. So yeah, today and tomorrow.
Yeah. Awesome. Okay.
Right.
Any questions, thoughts about DISC?
Yeah, challenges that you guys have implementing DiSC. What's your biggest challenge?
Like for new patients, is your admin team, Katie Lynn, I don't know if you answer the phone for new patients, but are you getting the DISC on the phone for new patients?
I get an idea, but I'm still working on getting to know the whole DIC as thing anyways. But there are new patients that will call and just straight up ask the first question. So how much is this going to cost me? And then you have these other patients call and say, well, how long has, so-and-so been practicing? What kind of dental? I mean, there's lots of different kinds, obviously. But that's something that I do want to get better at.
Yeah.
And I've noticed that past admin team have left what they felt that the patient was in their family file. And that's always been helpful to prepare or preheating as
Yep.
the front desk people. So.
Absolutely. Yeah. And you want to verify that research at the huddle, right? You share that, but then the clinical team member is going to have an idea of what you think, because that patient's calling from the safety of their home. So their DiSC may be more comfortable being a D at home, but then again, they show up and they're going to all of a sudden an S. They're like, Katie Lynn, you told me they were a D, and they were definitely not a D. They were an S. That's going to happen sometimes. So you give them an idea of what you're getting on the phone. You guys will have to confirm it chairside as clinical team members. Yeah. All right, good. Excellent.
Awesome. Good conversation. Thanks for playing with us, guys, on
Yeah.
the spur of the moment with no warning. DISC is a fun conversation.
Awesome.
All right.
All right. All right, Paul, we'll wrap up DiSC then. Is that good?
Mm-hmm.
All right.